Hello, everyone, and welcome to another alumni interview conducted by your pre-health ambassadors. Today, we'll be talking to Jake Molgano, who graduated from URI in 2019 and is currently in dental school. So to start, I'm Sydney. I am a biology and psychology major. I am a fourth year, and I'm a pre-med student.
And hello, everybody. My name is Julia. I'm also a senior at URI, and I'm studying biology, sociology, and Italian, and I'm on the pre-med track as well.
And I am Kelly. I'm currently a fifth year at URI, and I'm studying kinesiology and writing on the pre-PA track.
And hi, everybody. As Sydney said, my name is Jake, and I graduated from URI in 2019. And I currently go to UConn Dental School. I'm glad to be here.
Okay, so with our introductions, we can start with our questions. So Jake, can you give us a brief overview of what your path to dental school looked like?
Sure. So it's fairly traditional, nothing too exciting, but so I went to, I started school at URI in 2015. It's majored in pharmaceutical sciences, and then I graduated in 2019. And so right after I graduated in May of 2019, I applied to dental school that June. So I basically had a year off. So I took a gap year to do interviews, and I just kind of shadowed and learned more about the field and worked to earn some money while my time off. And then I started school in this past August.
So you mentioned that you were a pharmaceutical sciences major. Did you always want to go to dental school? And if not, how did you decide that you wanted to go to dental school?
Yeah, so I knew I always wanted to go into healthcare, not dentistry at first. And so one of the main factors I think was after my whole orthodontic experience, I had braces. So I thought everything after that experience, I was like, oh, this is pretty cool, and all the things they use, and how my teeth came out perfectly straight after having not a perfect smile to begin with. So I'm like, oh, this is, kind of sparked my interest. And going into college, I still wasn't fully drawn to dentistry. And when I started searching different health professions, I started shadowing my general dentist and others. And I'm like, just to try to see, how the field is and see if I could see myself doing this. And yeah, after shadowing, I knew this is dentistry was what I wanted to do.
Awesome, thank you.
Mm-hmm.
So Jake, do you have any experience in mind, or do you have a valuable experience that you had that prepared you for dental school?
So I think there's not one experience that was most valuable. I think all of them pretty much all together kind of were valuable into helping me get into dental school. So on the top of my head, I can think of definitely shadowing. So that's any profession. If you want to make sure that what you want to get into, that's the first thing you should definitely do to kind of dip your foot in the water a little bit. And I also did a lot of pre-dental days, at certain dental schools, such as Boston University. At UConn had one, and Rutgers Dental School had a 2-week internship that you did all these certain dental activities, drilling, picking up all these instruments, and kind of see what the whole field's about. Some of the things I did, went to dental seminars throughout the 4 years during undergrad. That was through the pre-dental club. So we did a lot of things like that to kind of just, figure out the field ourselves and together. And things like you're doing, the pre-health ambassador was a great program. And I love being ambassador again, that can make connections with everybody in all sorts of health professional fields. And yeah, so it's just, like I said, it wasn't one experience, but I think, combined in totality, I think that was all helped lead me to where I was, to where I am today.
And what is a typical day like in dental school or in the dental program that you are in?
Mm-hmm. So at UConn, we're one of the handful of schools that actually have a integrated medical curriculum. So for our first year and a half, we're actually with the medical students, and it's really cool. So we have our core classes, what we call it, which are like the biomedical sciences. And we also have a class on like ethics, laws, and statistics. And then we also have like anatomy labs. So we do a human anatomy lab with a cadaver. We do like histology and stuff like that. So those three classes are with our medical colleagues. So basically during the day, our day starts at like 8 o'clock. Go through all those medical school classes. And then after that, we normally have our dental classes. So different drilling classes and teeth morphology, etc. So if you also want to go into medical school, that's UConn's an incredible school for medical as well.
Thank you.
Mhm.
Awesome. So looking back on your undergrad career and that gap year that you said you took to apply, is there anything that you would change about your path? And do you have any advice for current college students thinking about this?
So I don't think, I don't know, I think everything happens for a reason. I know it's a cliche statement. So I don't think there's anything in particular I would change. Just kind of everything leads you to where you go, But as far as advice, I like to tell all the undergraduate students that get involved in campus, on and off campus, as much as possible, whether that be clubs or doing certain things like undergraduate teaching assistants or just any certain type of sports. They have club sports. I think just getting involved in leadership roles is fairly important for all the health professional schools. And I think to do that right off the jump is a great idea, as well as making connections with your peers, your professors. And I know URI is like a huge school, so getting to know your professors may be a little bit more difficult, but I think if you take the time to be that person that makes an appointment to go to office hours and introduce yourself to professors, I think making those connections is a great thing to do in terms of letters of recommendations and all sorts of that stuff. And I also think like making connections with in terms of dental school, like dentists all around where you live, your general dentist, this and that. And for any health profession, getting to know your physician or your PA or anything like that. I think basically the advice would be, yeah, just kind of get involved, put yourself out there, even though if it could be outside your comfort zone. That's definitely the number one thing I would say.
Yeah, I think that's really great advice, especially in the era of COVID. Getting involved isn't always easy, but I think it definitely pays off.
Definitely.
So our last question for you, I remember you saying that you studied pharmaceutical sciences.
Mm-hmm.
So obviously that's not really a traditional major for pre-health, but do you feel like that prepared you for dental school in any way, even indirectly?
Yeah, for sure. So I actually applied to URI as a chem major, and like right before I started school. I came across like somebody going to pharmaceutical sciences. I'm like, that sounds kind of cool and different. I think, and I don't know, I don't remember how, but I asked like a orientation leader or something to kind of meet up with a advisor, and so I changed my major right before um, school started, which was a good decision and for me at least. And so the pharmaceutical sciences had a lot of rigorous courses as all majors do, and so I think having that workload in terms of like a lot of credits and the difficulty like classes of like pharmacology and stuff like that, I think it in general nothing prepares you for dental school or medical school or PA school. It's difficult and time consuming and very rigorous, but I think in general that really helped me kind of figure out what it's sort of going to be like. So and you have the basic science background through that major. So I think it was a good choice for me.
Awesome. That's really great to hear. So thank you very much, Jake, for agreeing to come and talk to us today. Again, this has been another alumni interview done by your pre-health ambassadors, and I hope you all enjoyed watching our interview today. Thank you.